Good evening, everybody. Welcome to the final Emergency Preparedness Network COVID-19 webinar. And we are excited to have the series closed out by Wendy Anderson and Angel Jackson. They will be talking about how CNAs can protect their clients and patients from COVID-19 outside of work. So I'm Dr. Charlene. Well, not yet. I'm going to hang up in just a second. So I'm Dr. Charlene Brown, the CEO and founder of CNA Simulations VR and the co-curator of this webinar series. We want to thank the Maryland Emergency Preparedness Network, Preparedness and Response, the Department of Health here has funded this webinar series and really visioned it with us. MINCA, the Maryland National Capital Home Care Association, is Maryland and DC's premier trade association for home care agencies, private duty agencies, home health care agencies, and durable medical equipment agencies. So if you're interested in joining MINCA, just follow the link on your screen. If you'd like to learn more about EPN, the Emergency Preparedness Network, you have already registered to be on the mailing list by registering for this webinar. And of course, if you have questions about clinical simulations for CNAs, just reach out to me, and my website's on the page as well. Excited to introduce Angel Jackson and Wendy Anderson. I met Angel and Wendell, I think it was 2018 or 2019, at the national conference of the National Association of Healthcare. The US has one major professional association for certified nursing assistants, and they have an annual conference. And that's where I met this dynamic duo, the co-host of the Let's Talk CNA talk show, and just two real leaders in the national CNA community. Wendell was previously on the board of NACA, that National Association of Healthcare Assistants. He and Angel launched an online talk show for CNAs, and they have a real chemistry and energy and dynamic insights that they have agreed to share with us this evening. And so with that, I'm going to turn it over to Wendell and Angel and let them wow us with their insights about how CNAs can protect their clients, patients, and residents outside of the home during this crazy pandemic that we're all living through. Wendell, over to you.
All right, thank you, Dr. Brown. So as Dr. Brown said, my name is Wendy Anderson. I've been a CNA for 35 years, give or take some years. I've been working in my facility for over 20 years. I've been the lead CNA and unit manager there for 18 years. Been in long-term care ever since, and I really enjoy it. I'm quick to tell anyone, long-term care is the best place to be. But of course, I'm biased, so don't mean to offend anyone, Also, for a little while, I did do a little home health care and caregiving, assisted living. One of the reasons that Angel and I started the Let's Talk CNA show was to have information, keep CNAs informed on what's going on in the world of CNAs, the CNA profession. We actually been doing this, I believe, I can be wrong, but I believe we've been doing this about maybe 8-9 years. I could be wrong on that, but we have enjoyed every minute of it. So it was my honor after meeting Charlene. She was also on our show when we met 2018, maybe 19 at the NACA convention. So it's my honor to had accepted this invitation to talk about how we can protect our patients from COVID-19 outside the workplace. I am waiting on my co-host to join us.
I have an update, actually. So we just heard from Angel. She's having a little bit of trouble getting in. So I'm just now resending her link to her. So you continue on, and Angel should be appearing momentarily, but why don't you go ahead and get started?
Okay. So the first thing that I want to do is just do a small little summary about this. COVID-19 has affected CNAs in a big way. It's a lot when we have to fight this virus, especially in long-term care. We have to take care of our patients as well as take care of our families and ourselves. COVID-19 has really turned out to be something just unexplainable, turned our world upside down, impacted our lives drastically. As CNAs, we do need to practice protecting ourselves and our patients in the workplace and when we're not in the workplace, which leads me actually to my first question, which would be what would be some of the ways that you guys feel that you could protect your patients from COVID-19?
So if you would like to answer Wendell, oh my goodness, what is that noise? If you'd like to answer Wendell's questions, you have the chat is waiting for you. It's right there at the bottom of your screen. You can just jump in there with your thoughts, and we can't wait to hear what you have to say, but just use the chat at the bottom of your screen.
Yes, please jump in there. I know for us, it was a big surprise to learn about the different types of masks to use during this pandemic. I know understanding the difference between the mask really makes a difference in the protection that you're providing yourself and your patients at your jobs. So if you guys hear me say neighbors, at my facility, we refer to our residents as neighbors to go along with the PCC concept. So if I say neighbors, I'm actually talking about the residents at our facility.
Okay.
So yeah, so it took a lot to understand the difference between the mask and how they protect us and how they protect our neighbors from the COVID. So I will use my facility as an example during this webinar. So in the beginning, we was allowed to use just the regular surgical mask, which just was a protection when you're talking about the with the symptoms not being in your building. So we was allowed to use just a regular surgical mask. Of course, some people likes to use double mask, maybe their favorite logo or something like that, which is also fine, but you want to make sure that you have that mask underneath as your first line of defense. Hi, Angel. I see Angel has joined us. How you doing, Angel?
Hey, I always always. It's crazy. Oh my goodness.
Hey, Angel. So we were just talking about some of the ways we could protect our patients from the COVID-19. So I was using my facility as an example, starting out with the mask, the mask that we have to use when there's no positive COVID in the building. So that's where I was actually at, was with the surgical mask. But as well as when you do have COVID in your building, using the NK95 mask is more of what they would want you to wear. Now, that's not talking about being on a COVID unit. In most facility has dedicated a certain part of their building for anyone that's deemed positive, any neighbor that's deemed positive for COVID. So wearing the NK95s are generally used for any positive in your building. And then you have the K95 that you use if you're going to be interacting with anyone that's positive with the COVID-19 within your facility.
I'm gonna jump back in. Oh my gosh, that's
Uh-oh, you echoes.
whoa. All right, I think it's gone. Is it gone? I was just popping in to welcome you, Angel. Is it still echoing? Do you still hear that?
You could hear it a little bit. I didn't hear it originally, but I can hear it now. It's pretty strong.
All right, I'm just gonna be silent. So welcome, Angel. Woo. Oh God, it hurts my ears. Just a reminder that this audience is heavily focused on home care, and just take it away. I don't know why we're having the sound quality issues tonight.
Yes, thank you.
Ah,
It's okay, Dr.
Yeah,
Brown.
just a little.
So as I was saying, you know, I can't
Finally.
I can't speak for
Just blame it on tech. Well, okay. Well,
I can't speak for what you guys do in home health and as a caregiver in assisted living, but I'm sure it's basically the same as far as your protection, because the most important thing is to protect your neighbors, yourself, because in the long run you also want to protect your family along with that. Can anyone hear me? Everything went silent.
it's like a comic on earth. Angel seems to be. Just continue. I'll pop back in whenever her connection resumes.
Okay, that sounds good. You know, for me, I'm glad to be able to know that I'm protected at work and know that I'm protecting my neighbors when I'm at work. That is a security blanket for me, like Lionel from the Charlie Brown. That's a security blanket for me that I can go home and feel safe that I protected myself, along with I protected my family as well. So you have to make sure that if you have COVID in your building, you want to make sure that you're following all these different different procedures that
okay. I'm sorry.
I'm sorry, you just popped back in, Angel.
Yeah.
Anything you would like to share, Angel?
That was some. Why is my? What's going on? Can you see me?
I'm unable to see you at this time. I can't see Dr. Brown either. But I would continue until you just jump in whatever. So just jump in whatever you feel like it. Whenever you come back through, Angel.
Hang on.
So I know one of the biggest things that I hear a lot is CNAs, healthcare workers and caregivers. You know, their concerns are catching the COVID. You know, so do you feel? How many of you guys feel that CNAs spread the COVID-19 to their neighbors? Or I should say, do you feel that CNAs spread COVID-19 more than any other healthcare profession? I mean, CNAs all do have the closest contact and are often contact with the neighbors or residents or healthcare workers or caregivers. However, do you feel that as a profession that you're the reason that your neighbors or residents may have COVID-19? Please respond to us in the chat. I'm waiting.
Is there still an echo? There is, okay.
I can't completely hear the echo,
Yes.
but I can hear it
Lord.
doing different things.
There is a response in the chat. There's two of them actually.
Oh, that's awesome. I don't feel that way. I mean, I don't feel that way totally, Grace. Thank you for your response. Thank you for your response. No, I don't feel that way myself, however. Workers, healthcare workers are the ones that you have to be more afraid of, because we're the one that's coming to the building and leaving the building. Our neighbors or our residents doesn't leave, so it's not our neighbors that or residents that's bringing it to the building. It's someone else bringing it to the building, and most likely it is a healthcare worker that's doing that. So again, you have to be careful with what you do when you're outside of your job, outside of the workplace. You still want to make sure that you're doing your social distancing. You want to make sure that you're masking up. I know quite a few people that has tested positive, as well as people that hasn't tested positive. But you still want to be as careful as possible, because you do have to really, really, really think about it. If you bring it to your neighbors, it's possible that you can take it home, and that's what you don't want to do. Don't want to bring it to work, but you don't want to bring it home either. So I do believe in the mask. I mean, every time I walk out the door, I got my mask on. The only reason I don't have a mask on now is I'm by myself. But I do believe in wearing the mask.
Okay, there we go. All right. Can you see me now?
We
Can
can
you
see
hear
you
me?
and hear you.
All right. Okay. So yeah, you're right, Wendell, because the people in our facilities, in our home, in our homes, they're not going anywhere. We are the ones bringing it in. We are the ones that go out to Walmart and wherever. No disrespect to Walmart, because we
I
all need to
love
go. It's still
Walmart.
an essential place to go. But I don't like it, but we need it. I can't stand going to Walmart, but you have to go, and we just got to make sure, like Wendell said, that we're social distancing, washing our hands, and wearing our mask. And we need to do that at home, and then also, what with it's the holidays too, and you got family. And you really got to be careful. Girls trip giving, and we all did a COVID test right before we came. So that was like, okay, when we're gonna gather together, we either do that or we do Zoom like this,
Mm-hmm.
So yeah, we really got to be careful, before we go into to our patients' homes, our clients or patients or residents' homes, and make sure that we're protecting ourselves so we can protect them.
Thank you, Grace.
Gracie says yes. Thank you, Grace. Giving us some grace.
What do you guys think about what Zara had to say? She said, I'm so glad you're hosting a webinar on such an important and valuable topic in today's world. Some of the ways aides can protect patients, hand washing, masking, glove changes, limiting unnecessary visitors' interactions with others, maintaining distance when care needs allow, monitoring of symptoms and temperatures prior to seeing patients. These are all things that Zara is saying that CNAs can do to help protect their patients when they're outside of work. What do you guys think about Zara's comment?
Angel, I'll let you go first on that. Well, maybe not. So I think that's excellent. I mean, at my job, personally, when we come in, the first thing we have to do is take a temp. We take our temp, we mask up, we gown, and then we move about.
Okay. Yeah, it's absolutely.
Uh,
Yeah.
But you know
Yeah,
what?
you do have to make sure. Yeah, you have to make sure that you are, you're not sick when you're going in there. So if you know you got a cold or sniffling, make sure you're not doing all that. I know you need to come and take care of your patients, come to their home and everything, and they need help. But if you're not feeling well, then you don't need to come in there like that. You could probably call your agency or call whoever to replace you. A lot of times we're like, well, we need the money and everything, but you don't need to be getting anybody sick. So just got to think about things like that.
So that's a really great point, Angel. We have an interesting question from Chris, who I think is pushing the conversation forward. I know you were going to talk about the vaccines, but Chris is actually asking, he says, it's wonderful that you've been a CNA for so many years. Are you doing anything special to encourage CNAs to take the vaccine? I think
Talk about it, Wendell.
The topic is fair.
Yeah, that's a good question,
Yeah,
Chris.
go ahead, Wendell.
Very good question, Chris. First, let me say, as a manager, I will say that I am taking the vaccine. And as a manager, I have encouraged my staff to take the vaccine. Of course, everyone has their reason for why they will and why they won't take the vaccine. But personally, I feel that everyone should take it. If you're in the healthcare field, I strongly feel that you should take the vaccine shot. But Chris, now that you asked that question, now I would like to do a survey, if you guys don't mind. So, Angel, what can you ask them that question? I want to do a survey on that.
Okay.
So,
hang on. So take the vaccine. What were you going to say?
We just started the poll that you requested, asking people, do you plan to take the vaccine? So we're just waiting for the results to come in. We have.
Yeah, do you plan? You said, do you?
I'm going to show the results in just a couple seconds, as soon as people finish answering. But the answer options are yes, as soon as possible, maybe, not yet, or heck no. So,
okay.
All right, we'll give it. I'm gonna give it another 10 seconds.
Knowing that that healthcare workers will be the first to take the vaccine, we want to know how everybody is feeling about it. I mean, do you plan to take the vaccine? Is it yes, as soon as possible, maybe, or heck no, you're not gonna take it. Oh, look. Okay.
Oh, wow.
Here are the results.
We got
awesome.
good results.
That is awesome. That is awesome. I am so glad to see that percentage. One of the reasons that we wanted to
67% said yes, they will.
67%. Yes, that is awesome.
So, well, this is the percentage. So yes, as soon as possible. So the results of it is 67% said yes, as soon as possible. 20% said maybe, still on the fence about it. 7%. You can't hear me? Oh my gosh. Hold on.
I can hear you.
Can you hear me now? Okay. So I was reading off the percentages. It says 67% said yes, as soon as possible. 20% said maybe, still on the fence. 7% said not yet. I'm still going to wait and see how it goes first. And then 7%, another 7% said heck no. Bill Gates won't plant my mind control. Microchips in me. Oh my gosh. People really feel that way. That's 7%.
So
Hey,
now,
you know,
does
I'm not knocking.
that match what you're seeing out there? Are you finding that 67% of the CNAs that you encounter are lining up to get the vaccine, or how
Yes.
are your colleagues responding to the opportunity to get vaccinated?
Actually, from
Yes.
all the people that I spoke with, it's been pretty positive. So I would actually say that it has been at least 50% of the people that I spoke with said that they was taking the vaccine. What really encouraged me to take the vaccine was I knew a person that was just totally against it from the jump. And when they told me that they was taking it, I was like, oh, I have to take it.
Yeah. You know, me myself, I'm that 20%. I'm sorry, but I'm the 20%. I'm a little skeptical. You know, I'm not knocking it, but I need a little more time to see how it's gonna go. So that's just me. And I know, like, you know, 50% of the people I know, you know, want to do it like that. But I know more nurses, they want to take it, and more people that work in the hospital want to take it. But, like, you know, the average people I know, it's like half and half, you know. So, but yeah.
Well, let's make it personal, Angel. What would tip the balance for you? What do you think would what is it you're waiting to find out? And
Oh,
what
just
would inspire you to actually take the vaccine? What can America do to inspire you and the
aspire us people like
50%
the
CNAs?
20%. Well, maybe we're waiting to see, because it seems like it's so fast that it came out, and it's really not any, you know, a long enough, like, experiment or testing, you know. So we're really trying to iffy about it. A lot of you know, people like us, African American, are iffy about it too, because of, you know, some of the experiments back in the past, in the slavery days, and Tuskegee and all of that. You know, it's people are just a little skeptical about it because it hasn't had enough research for us. So that's why I was like, well, I'm gonna sit back and see what's gonna happen. But eventually, you know, I know in time it'll work, because it has, you know, with the other vaccines. So I'm just, that's all. That's what it is with me.
Well, you know, here's the crazy thing about vaccine. I mean, COVID itself has always been around,
Mm-hmm.
but um, when we encountered this COVID, it was like they had to find the right source. If I'm wording it correctly, they had to find the right source, antibiotic or whatever, to
Right.
relate this particular virus with, in order to be, you know, to come up with that type of vaccine. And of course, nothing is 100%. Of course,
Right.
I would never say that I know that it's going to work and it's going to cure everything, you know, because even when you look at it, you take the vaccine. So you use my facility again, if I have only 50% of the people in my facility taking the vaccine, I'm still at risk because the other 50% did not take that vaccine. So either way that you look at it, you know, it's still dependent on other people, or all the people to I'm gonna say at least 90% of people to actually take that vaccine for it to be effective, to really know if it's really working. Because right now you're going to get a lot of uh, this was the side effects of it, rather than this was the positive part of taking the vaccine, which goes along with, I see that we got a question from Zara. She was asking, in relation to the vaccine as well, do we know which category CNAs care providers, I'm sorry, who are providing care in residential homes fall into? Um, to answer that question, I don't know if I'm giving you the right answer. All I know is that long-term care or healthcare would be the first ones in my state, I know, to get
Yeah.
that.
Yeah, that's what they, yeah. Yeah, it's long-term care. The ones in the nursing facilities get it first.
Yeah, I'm not sure how it's going to work in any other state, but for our state, I know that our profession would be the first one receive the vaccine. I know they said by the summer of 2021, at least 92% of everybody should have at least been offered the vaccine.
Right. And
So
I know at my
question.
at one of my at my nursing facility, because I know you guys are in the home and they're not going to start with you guys first, but at my nursing facility, they're going to be starting it as of Thursday for the
That's
first
awesome.
series. Yeah. And then the second series will be next month. So they're already starting it.
That's the only part that scared me is the second series. Because the first one I'm gonna fight. I don't know what I'm gonna do on the second shot.
Hey, you should, if you fight it with the first one, then the second one, you should be fine. Oh, so Rebecca says she was able to get hers on the 18th.
Congratulations,
awesome.
Rebecca.
Where you from, Rebecca?
Here, you want to, I don't know, we have the option to
Florida. Okay, awesome.
Allow people to speak. I'm going to see if Rebecca, if anybody wants to actually ask your questions live, we're a small group tonight. So I'm going to go ahead, and if you want to talk, Rebecca, you can talk. In the meantime, we have PBG Best Care is really asking a really good question about they work with elders in their homes. And I think it is unclear. There's a lot of attention to making the vaccine available to people who are working with older adults and making it available to older adults. But sometimes home care gets forgotten, right? There's sort of like hospitals and nursing homes, people are thinking about facilities, but we don't actually have the answer, PBG Best Care, about like where I read online that home health care is considered a part of the second wave, along with adults over 75, but I don't know if that home health care includes private duty. I don't know if it includes non-medical.
It should.
I agree that it should. I just don't know if it does. If anybody else on the call knows, drop a line in the chat. Raise your hand. We can learn from you as well. But Rebecca, you don't have to talk, but if you want to talk, you can.
That's a unique way to spell your name too, Rebecca.
I know that while we're waiting to see if Rebecca wants to speak, or if anybody else wants to speak, just let us know. We can turn this into a conversation.
Yes.
It comes up a lot that CNAs, because CNAs are doing such high risk work, right? CNAs are frontline working with older adults. Older adults are especially vulnerable to this virus. And Wendell, you were mentioning earlier that COVID is a novel virus, right? It's never really existed in humans. Like this version of COVID, SARS-CoV-2, this virus that causes this COVID-19 is like first time in humans, right? So like we're living through history. We're living through some kind of crazy science fiction apocalyptic.
Oh, I'm telling you. In 2020. Like a sci-fi movie.
We're living through it. And so because this is unprecedented, the idea of a vaccine, like this sort of rapid fire, like intense research that went into creating a vaccine faster than I've ever seen in my entire life. It's like it's almost like we're in that movie and we're waiting for like that special cure, where everyone's like crossing the country to go find the CDC. Like it is not a cure, but potentially has the ability to impact these death rates. We have 3,000 people dying a day, hundreds of thousands of people are dying, and people with long-term disability. So we have this tool, this new tool in our armamentarium. How can, for those of the people on the call who are, oh, Rebecca can't turn on her mic. That's okay. You can just type in the chat then. But for anyone on the call who's an employer, right, who has a team of CNAs or other employees and that are on the fence about the vaccine, do you think employers can influence the decisions of their staff in any way? Like, do you think that there are things that employers can do that would make a difference to get people to take the vaccine?
Well,
I think so.
I think all they can do is ask, recommend, and just inform them on the reason for taking the vaccine.
Mhm.
At this time, you know, it is an early stage of a new vaccine.
Mhm.
So a lot of people, you know, as Angel said, is skeptical of doing it. Uh, the people, when I talk to people, this is actually what I say to them. I say, now you know that if you take the flu shots, if you take the flu shots, your reaction is going to be your arm is going to be sore. You may get a fever. You may feel worse than expected. But is that all the symptoms that you should be looking for? You really don't know. You just really know those because that's what you've been told all your life. So what are the real symptoms? If help me out, what's the word I'm looking for? Side effects. Thank you. What are the real side effects to taking a flu shot? You really don't know if you're not really off into it, but because you've been doing it all your life, it just seemed like a norm. And
Right.
until everyone do the vaccine, it's not going to seem like a norm. It's going to seem out the norm. So again, for me, I say that and I tell them, I said, although I love my neighbors, I'm actually doing it for my son. Because if it doesn't work,
Right.
it affect him. It affected me first, and he had that opportunity to get that right vaccine, get it right where it needs to be. Not saying that I'm not hoping I'm getting the right one, but I just want to make sure that if I can help make his life longer, then that's what I'm gonna do. And I feel like all healthcare workers again uh, are responsible for being that first line of defense with this particular vaccine, because we also have to continue to encourage our neighbors, our residents too, because they're just as scared as we are. So if we're panicking, they're going to panic, and then they're not going to want to do it. But if we do it, then they'll feel more comfortable doing it. So that's more comfortable. And
Mhm.
like it's the norm. It's the norm to
I think
take the
Angel's,
vaccine.
Angel, are you trying to say something? Angel, are you trying to say something?
It sounds like she's trying to get back on.
Wow. All right. I think she dropped off. We're gonna have her come back. So thank you everyone who's sticking with us through these crazy technical difficulties. But Zara made a really good point in the chat. She said that, you know, whether or not employers actually mandate the vaccine for their staff, it's actually the patients themselves that are gonna want to be taken care of by people who've been vaccinated, right? So if it's in home care, then, you know, some patients who will be like, well, I don't want your home care unless the CNA that you send to me has been vaccinated, right? Like, how do you?
Right.
And I don't know what's going to happen in the nursing homes either. I don't know if the patients are lining up to get vaccinated, like give it to me now, or if they're going
Yeah.
to be, you know, if families of patients in nursing homes are gonna like vote with their feet and go to the nursing homes where the staff are mandated to get vaccinated. Who knows? I'd love to hear your thoughts on how you think the perspective of patients might influence and put pressure on CNAs to get vaccinated.
I'm sorry, is that a question for me? I'm sorry.
Yeah, that was my long-winded question. I'm gonna make it real short. I was adapting Zara's question. Basically, do you think patients are gonna put pressure on the system that push more and more CNAs to get vaccinated because they won't want to be taken care of by people who are vaccinated?
Okay. Again, you know, I have to speak from the perspective of my facility. Basically, my neighbors, they feel that they should take it, and they feel that the staff should take it. And in their words, it's because we love y'all and we want everybody to be safe. So, with that said, I do feel that the neighbors will put pressure on the healthcare system to mandate that uh, CNAs do be vaccinated or home care. aides or caregivers do be vaccinated before they come and take care of them. As well, with that said too, I read somewhere, I meant to take notes on it, but I did read somewhere where the federal government is giving each state the opportunity to make that choice whether or not they want it to be mandated in their facility or not mandated in their facilities, and what those what the outcome would be up to that particular facility. Right or wrong, I understand, but I don't personally think the facility should mandate it, because you do have to give people a chance to cozy up to the idea of taking a new type of med that's just coming about, so to speak. But yes, to answer your question, I do feel that uh, neighbors, residents will eventually be in that position where our family members will be in that position where they're going to mandate that it's only people that's been vaccinated should take care of their loved ones or take care of them. Should take care of their loved ones or take care of them.
Okay, so Angel, there's some weird feedback coming from your mic. So when you're not talking, I'm just going to ask that you mute, just because there's a weird sound that's coming through. But I have a question for you.
I'm trying to do this thing. I'm sorry.
It's okay. We got a couple questions that I'll ask you to take on, Angel and then Wendell. So first of all, we have a plea, which I thought was really heartfelt, about like how disheartening it is that this is PBG Best Care. Would you know who we could reach out to ask that we be considered as healthcare workers? It's disheartening that we are the forgotten group. And I think that's true. Is you don't want to be like anyone that's laying hands on another human being to deliver care of any kind is a frontline worker and deserves to be protected by this vaccine. So I think that's unambiguous. Chris has, what do you have to say to Chris, Angel? He says employers can provide education about the development process, the number of candidates who were in the trial, side effects, and to remind everyone that this is global, not just the US. He said the reason the vaccine is so available is that the federal government invested $9.5 billion to speed up development. So do you think, I mean, Chris is dropping facts, right? These are facts. But do facts matter? Do facts matter when people don't trust? How are facts going to help change people's minds about getting vaccinated? What do you think, Angel? Oh no, we don't hear anything, but we see that she's talking.
Well, I don't know if facts are, because a lot of people don't facts. Oh, wait a minute. Oh,
we can hear you. Oh, she's on. It's like, well, Wendell, it's your turn. When Angel comes back, she can resume. But do you think that educating people about how the vaccine?
Can you hear me?
We can hear you now. We can hear you now. We're like one of those commercials. Can you hear me?
Okay. Can you hear me now?
All right, Angel, go ahead. Why don't you, maybe if you keep video off, let's see if the connection.
Can you hear me?
Yes.
I believe like it's like. Can you hear me now?
Yes. Go ahead. Okay.
So, as far as the numbers and every even facts, like that. But I think with Wendell, what he's talking about, like he wants to, and people go by example, like, oh, I did it too, so I'm feeling like this, I'm feeling okay, and I haven't got the symptoms, you should take it too. I think if more people encourage that are getting it, like, what Wendell's saying, what he's saying, I think more people would get it. And like somebody else was saying about the employers, can they influence? I believe they can. They can influence. They can't make you take it, but they can encourage you to take it. would help a lot more than just the statistic or the so-called facts, because we got so many so-called facts as far as Facebook, social media, and all this other stuff. And a lot of times they're like, oh, that's fake, so, but if another person can say, hey, I'm taking it too because of this and that, like because of my son, I want to be an example. That can help people to do it, So I believe that's what'll help is, leading by example.
Angel, I'm gonna invite, I think that's really insightful. I'm also gonna invite you to do an experiment. If you turn off your video and see if we can hear you better. You're beautiful. We love seeing you. But let's see, because your connection is spotty. Let's see if you turn off video, if your audio comes through more consistently. And while you're doing that experiment, we have more stuff. All right. So Mary Bloomfield, I think that will be more likely in home care where CNAs are going to the patient's home. She would not be surprised if patients and families in private home only want someone who's been vaccinated. I wonder if they're, I have a question for Mary. Mary, are agencies gonna require their clients to be vaccinated to protect their CNAs? I mean, what goes around comes around, right? Like if a family's gonna insist that they only want vaccinated CNAs to come to their home, can agencies insist that their clients be vaccinated so that their staff is protected when they go to their homes? Inquiring minds want to know. What do you think, Wendell? And then Mary, let us know what you think in the chat.
I think it's only fair. I think it's only fair because if I'm vaccinated and I go into your home, but my client or your other family members there are not vaccinated, and I'm still prone to possibly being an asymptomatic positive person. Yeah. So yes, I would think that everyone would have to be vaccinated. That's a good question, man. We waiting on your response now. Yeah, but I definitely feel that way, which is something I was going to bring up too while we waiting on Mary to respond is you have asymptomatic and you have symptomatic. A lot of times people test positive, but they're testing without the symptoms. And then you have the ones that's tested and they're showing the symptoms. And those are the ones that people tend to be more afraid of. It's the symptomatic ones versus the asymptomatic because of the different, because of one showing the symptoms and one not showing the symptoms. But if you're saying, you know that you're positive, you definitely should be doing everything you can to still make sure that you're keeping yourself and everyone else safe around you, because it's not saying that you're not contagious, it's just saying that you're not showing those symptoms.
And two, Wendell, for a long time, they weren't testing people. They weren't trying to really test people that were asymptomatic, at first. They were just trying to do the ones that had symptoms. And now they're testing everybody. So that was an issue. And, that kind of helped I wouldn't say help, but that kind of caused the spread because there were a lot of people that were asymptomatic and, they wouldn't test you, unless you said, oh, I've been encountered with, or I know for sure I've been encountered with somebody that had the COVID, and then they'll go ahead and do it. But, so it's a lot. It was a lot of that going on before.
Right. I see a response from Mary. That was actually a good response, Mary. But she was saying that she don't think they can require patients to get vaccinated, but they can require that they get tested before agreeing to care for them.
Right.
I agree with that as well, but an average, the return rate is what, 24, 72 hours on a test. So that means that client will probably be without any assistance for quite a while. So that's something that the agencies would have to figure out. And someone said something else about I lost it. Uh, Mary, like we don't require our patients we're not requiring our patients to take the vaccination, but we are seriously, encouraging them to take the vaccine shot.
It's all about being encouraged. It's all about encouragement. I'm sorry, y'all.
I don't actually think a long-term facility anyway can actually mandate the neighbors to take a vaccination shot. Maybe before they come to that facility, they can mandate that. But I don't think they can mandate that I think a lot would have to change for something like that to happen. And again, this is only my opinion. I don't know this for a fact, but that's only my opinion, because when you look at all the different type of laws, I mean, you really can't demand or mandate any neighbor, patient, resident to do anything. Everything has to be their choice, or at least their guardian choice to what they can and cannot do. And I see
Chris actually really liked Angel's comment about following by example. He said, I appreciate that following by example matters rather than just facts. And so that's a compliment to you guys. And we have quite a few people. Oh, go ahead, Angel. Yeah.
Oh, and then, with the older generation, they don't believe in some of those facts anyway. They just go by, word of mouth anyway, because that's how people that's, I wouldn't say old school, but the older generation, that's how they go by. Yeah. It's by, oh, what did Sue do? Jimmy did this, I think I'm gonna go ahead and do it too. But when Jimmy did that, it didn't even work. So I'm not gonna do it either. So they usually go by word of mouth anyway. So
that's kind of what I said earlier, Angel, was, really most people don't know what the side effects of any type of vaccine really is. You just know based on what you was always told, I mean, because you trust your doctors, you trust your providers. So if they say this is what it is, then your trust is this is what it is,
Yeah.
And if they say you may get a bad headache, then you like, okay, I'm waiting on this headache. Oh, I didn't get the headache, so I didn't have no side effects. So that's kind of what you look for. And from what I've read, there hasn't been any serious side effects from the vaccine. So again, I'm good with it. So I will be one of the people that will be taking the vaccine shot. And I hope that you guys, the 6 or 7%, I'm glad that you guys are going to be taking it. And I hope all you other guys that's with the Bill Gates, I hope y'all jump out the fence and you guys take it, because it's only going to work if we all come together as one and deal with this particular virus.
Absolutely. It's 7:56, guys. And so why don't we're going to start moving towards wrapping up. So I want to give each of you a chance to share some closing thoughts. I mean, we've had a couple of themes that have come up in the discussion. One is the importance of example, whether it's Angel's point about older adults listening to each other more than they're going to listen to, analysis of the vaccine research, whether it's coworkers learning from each other about their own experiences, like Wendell was saying about side effects. There's this sort of fairness of should patients get vaccinated? Just can CNAs refuse to take care of patients who are vaccinated if they want to refuse to be cared for by people who are vaccinated? There's all kinds of issues of justice and fairness and trust going on with this pandemic, and with this essentially number one tool for how CNAs can protect their clients outside of the home. Like the number one thing right now is get vaccinated. So closing thoughts, Wendell, then Angel, what do you want people to know, both from your personal perspective, but also from your perspective as leaders in the CNA community? What is it that you want people to remember from this conversation?
I would say, remember that don't be afraid of catching the virus from your neighbors. Just be aware that it's not your neighbors that's bringing the virus to you, it's you bringing the virus to the neighbor. So you have to do what you have to do to protect yourself and protect your neighbors. Stay
Okay.
masked up.
And by
That's it.
neighbors, do you
Yeah.
mean residents or do you mean actual neighbors?
Well,
in-
as I said, if I say neighbors, I mean residents. So residents.
I got
Residents,
confused for a minute
residents,
there. I was like,
patients, or if you're in a home, setting, is patients or clients, But like Wendell said, you got to make sure that you protect yourself, and wherever you go, think about where you're going. Make sure you're washing your hands. I know I'm on the fence for the vaccine, but I'm planning on getting it. Because we got examples like Wendell, so I'm looking at his lead, and I'm be like, okay, I think I'm gonna go and do it. But it's very important that we take the steps to, so we can take care of ourselves, our families, and our patients and our clients and residents. So, it's very important that we do that, and then that way we can get rid of this pandemic and move on with our lives.
Here. I love these closing arguments, man. Wendell, do you see what happened there? Angel's like, I'm inspired by you. I'm gonna follow Wendell's lead. I love it. I love it. Now Zara wants to get in on the closing comments. So I see we have a paragraph. All right, Zara, we're gonna read it. I think one of the key points to remember is that as far as I'm currently aware, the vaccine is certainly strong and effective defense. Yes, we all agree. But receiving the vaccine doesn't automatically mean the individual cannot transmit the virus. This is also true. They have a line of defense to prevent themselves from getting ill, but as far as we seem to know at this time, they can still carry it and pass it on to others. Well, it's actually, like, there's a lot that we don't know, but people may get the vaccine and start to get a little lazy. I think it's really important to remember that it doesn't mean we're in the clear, and that masking and hand washing will continue to be vital. What do you guys say about that? I see Angel nodding her head.
Thank you
this
very
is true.
much.
Yes.
Thank you very much for adding that. Thank you for
true.
adding that, because I'm sure going to be doing that and encouraging people to still do it. So,
yeah.
Oh yes, it's very important, because you know what? When people weren't washing their hands like that, that's why it was a big spread. So now everybody knows in their mind and their mental that that's what you need to do. You need to continue to do that, because it might be something else out there, like, MRSA, E. coli. There's other stuff out there, the regular flu. You don't want to get that stuff either.
Nope. You don't want to, right now, you just don't want to get sick. Like, you just don't want to get sick. The hospitals are full, the rates are going up, and things are upside down. And the vaccine rollout is slower than anyone said it was going to be. So you are correct. Everybody's correct. Rebecca is shouting from the chat. Yes, she agrees as well.
Thank you, Rebecca.
So Wendell and Angel Jackson,
Yes.
co-hosts of Let's Talk CNAs.
That's
so
right.
Amazing. I loved you guys when I met you. I love you now. Like,
Thank you.
I just feel so energized by your insights, your dynamics, and your transparency in terms of sharing what you know professionally and personally about kind of what's going on in people's minds. So let's go out there and continue to build trust within the CNA community. Let's continue to do what we have to do to fight this pandemic. The masking, the hand washing, the social distance when possible. And here comes, the vaccines are coming. They're coming down the pipe.
There you go. And one of the things that we did not say in this, and I'm really big on this, sanitize your hand as well, because every time you touch something, you're getting some type of virus on your hand. So sanitize. Now, don't hand wash, but sanitize in between there too as well.
And make sure you're not touching all on your face and stuff, because it can get in your eyes and your nose and mouth area, and that's how a lot of people get sick.
Absolutely. And that is going to be true post-pandemic, just like it's true now, right? Like you said, many infectious organisms.
That's
you guys, Let's Talk CNAs, you rock. Thank you.
Thank you.
Anastasia says, Wendell and Angel, thank you for your advice and guidance. Dr. Brown, you're terrific. Thanks for organizing this webinar. I think you guys are terrific. And I want to thank those of you who are on the call. This is our final, we had a whole series of webinars this year focused on COVID and pandemic and all of the issues that are important for caring for older adults. Thank you for being a part of this webinar series. We are going
Thank you for having us. Yes, we are honored. Thank you for having us.
Thank you.
Yes.
Thank you.
Oh, and we want to add that you can, everybody, you can check us out on YouTube, Instagram, Facebook, and Twitter on Let's Talk CNAs.
Where knowledge is empowerment.
Empowerment, yes. And you can also email us at 411-letstalkcnas@gmail.com if you have any questions.
You want to repeat that? Go one more time.
411-letstalkcnas@gmail.com.
Now, there's no apostrophe in the email address, right? It's just
no.
Yes. Okay.
Yes. No.
All right. If they want to find you on Facebook or YouTube, if they just type in like YouTube, Let's Talk CNAs, LET' Talk CNAs, they'll find you.
Yeah.
So pop right up.
Yep. Pop right up. You'll see us. Hey.
Go find them online on social media. Check out their talk shows. They're really fun and dynamic, and they cover all kinds of really important topics. Wendell, Angel, thank you, thank you, thank you. Everybody, thank you. We're gonna wrap it up now. Happy New Year. Be safe, be strong, and
Happy New Year.
All right.
All right. Happy New Year. Good night.
Okay, have a good night.
Thank you.